每8个人里面都有1个人会有可能得到被 B 型肝炎感染。
I always like to show you a little bit closer look if I can. This is what Hep B really looks like. If you have a microscope, electron microscope, it looks like one of those World War II bombs that they used to leave out in the building. And it's a bomb floating in your blood.
如果你有显微镜的话，你可以看到这就是 B 型肝炎的真正的样子。就他形容这个就好像是那个2战里面的一个炸弹一样。
Just to give you an idea, if I take a drop of blood with Hep B, put it on a needle, and I come over here and stick him, and he doesn't have the vaccine, he has between a 30 and a 50% chance of getting Hep B in the next 30 days. One.
他要是哪一个针有 B 型肝炎的血在里面的话，就是如果拿这扎你的话，你就有大概50% 的机会会得到 B 型肝炎。
Again, surrounds us, but it's also here. Remember, about 2 million Americans have it here, but notice, Central America, Alaska, Northern Canada, Greenland, especially Africa, and especially Southeast Asia, very afflicted with this disease.
虽然就像 A 型肝炎，虽然说美国没有很高的 B 型发生率，可是你可以看到在亚洲，尤其是在中国这带地方，就是有非常高B 型肝炎的发生率。
So in the United States, back in about 1990, before the vaccine was fully implemented, it was 59,000 cases in this country acute every year. And then it's now dropped to about 9,000, mostly in people who have never been vaccinated. So that's an important issue to think about. Again, 3/4 of jaundice, half go in the hospital, usually about 2 to 4 weeks. Maybe a week or 2 in the hospital, 4 weeks maybe at home, maybe lucky they get to work, and they do go to work the other way on that aspect, because they're very jaundiced with it. 1.3% die, so that's a little bit bigger number. The vaccine came out in 1981, but many people didn't get it unless they were a doctor or a nurse. It was really 1991, infants were getting it at birth, they started screening women, they did the catch-up vaccine, and also the high-risk people were getting vaccinated.
这里说就是当疫苗出来之后，就是从1999年大概有6万个病例下降到2019年9000病例，然后就是你要是有 B 型肝炎的话，大概有80% 的人皮肤会变黄，还有50% 会住院，然后大概1% 会死亡，然后就是在1999年政府行使了那个疫苗注射，然后现在就是对 B 型肝炎有很大的帮助。
So let's look at what happened here to see if the vaccine made an effect. So 1990 we're here, and you can see the nice visual of how nicely it was dropped.
我们现在看到就是当我们有疫苗之后，发生率大概下降，从6万病例下降到大概1万5左右。
Most people at risk, it's not the older patients, although they're not without risk from this aspect. It's really the 20 and 30-year-olds from that aspect, because the risk is sectional from this aspect.
我们这里可以看到，就是大多数感染 B 型肝炎的人病菌的人都是从20岁到30岁左右，因为这些B 型肝炎是可以从发生性行为之后传染的。
And again, this is a slide to show you how much of an impact this made for our Asian community. Notice the Asian Pacific Islander community clearly was one of the highest here, only followed by, actually, higher was African Americans. And notice everybody nicely has come down from this aspect, a little bit higher still in African Americans.
大多数看我们这里看到就是大多数亚洲人是在 B 型肝炎感染率算是最高的。
So again, how do people get this? Well, this disease that has an incubation period of 30 days to 90 days, when they interview these people, 1,000 or so that the CDC interviewed, 60% or more than half had no idea who, how, or when they got this. But the ones that did, it was sexual. But notice, surgery has been linked, needle stick, and that, remember, people in the hospital, so it was vaccinated already, but obviously some didn't. Household contact, important, and also job exposure. So some people who maybe don't work in the hospital, but deliver things to the hospital, getting accidental exposures.
B 型肝炎病毒有大概到30到90天的空窗期，有大概60%的，我不知道他们为什么是怎么得 B 型肝炎的病毒。可是像我们这里可以看到，就是很多是因为发生细行为，也有些是在那个做手术的时候感染到。
This is what I call the reality check. 1 in 4 people with chronic Hep B will get cirrhosis. This is what cirrhosis, you hear it, but this is what it looks like. This is a cirrhotic liver removed at a transplant, and this is what it looks like. This is what cancer can look like. 1 in 4 people can get this.
大概每4个有慢性 B 型肝炎的人会有肝硬化，或者是会得肝的癌症。
Reality check. Okay? 1 in 4. They've been vaccinated. Who do you think it's going to be? Mom or dad? Mom or dad? Reality check. It's not your kids. It's you. Anybody here? Every 4th person here want to raise their hand? That's how many people. From that aspect.
他说就是你们的孩子都已经有疫苗了，所以说最容易得到被 B 型肝炎给感染到就是你们自己。
So remember, I don't like this. You don't like this. The kids don't like this. We really don't like this.
虽然说你们不喜欢打针，可是你们如果跟这2个相比的话，打针比这个是好很多的。
I always like to show you an even more reality. That was a fake slide, but I showed you the data. This is Mrs. Wang. Mrs. Wang is shown here with her 2 children. Notice how sad she is. True photo, real photo. She is standing here after attending the funeral of her husband, who died at the age of 34 of liver cancer caused by Hep B. One of 250,000 Chinese killed every year due to Hep B liver cancer or cirrhosis, and this was in Henan, China.
这里他说的是这个女人的老公在30岁的时候死掉了，然后现在她要单独一个人照顾2个孩子，然后还有就是大概每年都有25万的中国人死于B 型肝炎所导致的肝硬化。
Not just a disease of the old, so the other 2 one of it. So how good is the vaccine? The vaccine, if you get all 3 doses, works at over 90%. If you don't respond the first time and you get it again, half the people it'll work, more or less. People on dialysis are sick, but even they can get almost half to 2/3 can form a vaccine. And if you know that you got the vaccine and it didn't work, and you work in a hospital and get a needle stick, if they give you the immune globulin, you can still avoid it if you get it within a few days of the exposure. Immune globulin is basically antibody from a healthy donor that formed it. They can take healthy donors, vaccinate them, take the plasma, and make it super rich in immune globulin, and then if you get a needle stick, boom, you get that instead. So even if you can't form the antibody, they give you from people who did.
如果你打3针B 型肝炎的疫苗的话，你有大概90% 的机会是可以变成有抗体，然后就是如果你一开始对疫苗没有反应的话，你如果 再重新注射的话，大概有一半的病人都有可能得到抗体。
Everybody wants to enjoy this moment. Can you imagine visiting your grandchild, or your daughter just delivered, or your wife just delivered, there with your child? You don't want to think about this. You don't want to think about this, but you have to.
你虽然是不想给你这么可爱的宝宝打针，可是你要为他们的将来想一想。
Why? If you're having children, usually you're young. If you have Hep B and you're young, you're usually E antigen positive. E antigen positive mother has a 90% or more chance of passing this on to baby at birth. If you give the vaccine and the immune globulin, it drops to 10 to 15%, but not 0. If you're E antigen negative, usually now the mom a few years later, maybe the first child got Hep B, but maybe the fourth child or third child will maybe not get it because mom may be now late 30s and not E antigen positive anymore, less than 5% risk. But if that mom gets the vaccine, immune globulin drops to 1%. In the U.S., they check for surface antigen, not E antigen, and they give everybody the vaccine, but this is important for you to know. The vaccine program was implemented in Taipei City, and it has dropped the D surface antigen carrier rates from 10% to 1% in young people, less than 20 now. And similar was seen in Gambia and Korea, where it went from 5 to 10% now, less to 1%. So the young people are getting the benefit of the vaccine.
有 B 型肝炎的母亲们，他们大概有90% 的机会会传染给他们的孩子。可是如果你有疫苗的话，大概那个下降到大概10到15%。这也就是说，在台北还有韩国，就是因为疫苗的关系，他们B 型肝炎的传染率下降到大概少1%。
So this is a slide now correlating when you get it with the risk of cancer. Notice the highest cancer risk is getting this from your mother, followed then by getting it in the first 2 years, and then it goes down from there. So Americans who get this here sexually in their 20s and get chronic Hep B have a lower cancer risk than somebody who was born in Taiwan or China that got Hep B from their mother. It's because of the years of the virus. It is a DNA virus. It gets in your DNA from that aspect.
他是说，就是孩子们最可能被传染的渠道就是从他们的父母。
So this is an actual trial done in Taiwan by Dr. Chang. She basically did a trial of high rates of liver cancer in children. That's a sad to think that in Taiwan they basically have 0.5 per 100,000 children with liver cancer. Imagine your child with liver cancer from Hep B, how horrible that could be. But thanks to the vaccine program, now it's dropped to about only 20% of that. So much lower numbers. Still not 0, because remember, if mom is E antigen positive, the child still has a 10 to 15. So it won't go 0, but much lower from that aspect. And so this is very important to get. The vaccine must be given to the child born of the mother within 12 hours. They recommend that you do it in the delivery suite because before you know it, people forget. And they actually did a study and showed half the people leave and don't get the vaccine.
他说就是在台湾，因为注射 B 型疫苗之后，就是发生率大概下降了2倍左右，然后对。
All right. I thought, since this is a Taiwanese cultural center, you would appreciate one of the biggest, most historic, most important hepatitis B studies done ever was done in Taiwan. It's called the REVEAL study. The REVEAL study monitored about 4,000 Taiwanese patients, and it followed them with their DNA levels and what happened to see who got cirrhosis and who got cancer. In green here, you see that if you're above 2,000 international units, basically the cancer risk went up. If you're over 200,000, the cancer risk, as you can see, went to 10 times from that. If you now look at cancer risk, same thing. The same number held true, 2,000, and then 200,000. So you can see, both for cirrhosis and cancer, if you have more than 2,000 international units, that was where the risk went up.
他说就是你要是有很多B 型肝炎的 DNA 在你体内的话，你更有可能得到肝硬化还有癌症。
Controversy always exists. Many doctors have tried to come up with what's the right way to treat hepatitis B. Evan Keith, in the expert opinion, came up with what most people have used for a while, which is this one here, that if the liver enzymes are normal, but the DNA is above 20,000 for E antigen and above 2,000 for E antigen, they would consider a biopsy. But if they didn't, they would wait until the liver enzymes went up to consider treatment. But they waited until the liver enzyme was up and the DNA above 2,000 for the E antigen negative or 20,000 to actually treat. Very famous hepatologist at the Stanford University, California, his name is Myron Tong, basically did some research. He had been following many Asian patients and other patients with chronic hepatitis B, and so he had followed them for many decades. He knew what had happened, so he took the Asian Pacific guideline, the Liver Society guideline, the U.S. expert opinion that I just showed you, and the European expert opinion, and tried to look and see how many of his patients would still develop cirrhosis or cancer. And he found between 40 and 21%, even with the most aggressive guideline, would get cancer. So he added a low albumin and a low platelet count and a special mutation called the basal core promoter. And with this addition, now filtering the same guidelines, he found that he could get in that same group between 1.5 to none of the patients would have been missed.
在 Stanford 的那个童医师，他就是对亚洲人特别做一个研究，他就是他研发了一个治疗方法，就是你如果在治疗方案中再加这两样，一个 albumin 还有 BCB 的话，就是从这里 percentage 就是说大概有多少人那个没有被治疗到，可是加了这两样的话，你可以看到减少到这个就是每个人都有可能被治疗好，还有这两样比较没有那么厉害，就是也只剩下1.5%。
So an easier way, let's do it so it's easy to remember. So on Dr. Tong, if the Hep B DNA is over 2,000 and the ALT is high, which for a man would be over 30 and a woman over 19, then it's easy. He would say to treat. He would say don't treat if it's less than 2,000 or the ALT is normal. But we live in a world where things aren't straightforward, and sometimes you'll see the ALT is up but not the DNA, or the ALT isn't up but the DNA is. So what he did is he came up with the gray zone for those people to look at from this aspect. And in there, what he did is if your age is over 40, he gives you 1 point. If you're a man, that's an extra point. If your ALT is above 30 or 19, you get 1 point. And if you had those three, that would be 3 points, so that could force the idea of treatment. But some people have already a history of a family member who died of cancer, that's 3 points. If you have the low albumin or platelets, which is a sign of possible cirrhosis, that's 3 points. But for those people where none of these points were there, he gave 2 points if this mutation was present. This is free as far as getting the history. These you know very quickly. This test costs about $500 to do. So it's a test that we don't routinely do, but I use it sometimes if I'm worried about somebody, and if it comes back negative, it tells me they're at lower risk, and again, that we're okay to keep watching if you believe that Dr. Tom did.
他就是说，他们设计了一个方案，就是他就是看你的年龄、你的性别，还有就是不同的，就是你，就是那个血液测试之后，要是得到不同的结果的话，他会给你一个 总结就是说你要不要那个受治疗还是不受治疗。
Now, if chronic hepatitis B is there, these guidelines now indicate you need treatment. Options in the past included interferon, which a lot of people did not like, and oral, which is what most people are on. Transplant is an option if the person has a cancer that's not resectable, but in a limited fashion, or if the liver disease is getting worse in this aspect.
你要是有B 型病毒的话，那你可以试着吃药，或者是如果严重的话，也可以那个器官转移。
Very busy slide. What I want you to see in this slide, what they did is they took everybody at 1 year, and what they found was that about 2/3 of the people, the DNA would be under control, but in reality, it's not as many people are helped by this. So this led to oral therapy being continued, and this is some recent data from Myriad, which has now into the 6th year, but this is the 5-year data from their webpage showing you that you have 49% of the people at 5 years actually having a seroconversion of the E antigen. This is very good. This is in a car analogy where your car has gone to stop, and now you put the car into park. We've actually seen that 9% of the patients at 5 years have lost all surface antigen. This is very important because that loss of surface antigen means, in the car analogy, the key is out of the ignition from this aspect. The engine is off. Very important from this aspect.
他就是说那个你如果吃药的话，它就是大概有现在就是大概有在5年后有大概50% 的人得到有效的治疗。
For E antigen negative, which is what many people are when they're older in this aspect, interferon was very disappointing, didn't work well at all, didn't last. So the pills quickly became the mainstay there from this aspect. And on long-term therapy, the patients have done very well with the pills.
他说，只要吃药的话，就有吃药后很多病人都有得到很好的疗效。
Liver biopsy, hopefully you won't need to do, but if a liver biopsy is done from this aspect, the patients that have cirrhosis usually have a very thick nodule around the liver, and then in stage 5, which is a little bit what they call incomplete cirrhosis, you see it's not as prominent, but still pretty thick. Then there's bridging fibrosis, and then there's portal-portal bridging and so forth. So you can see that it quickly gets very heavy here. If you look now at patients at 5 years with Myriad, for example, they followed 93 subjects who had cirrhosis, and they found that at 5 years, 72% of the patients with cirrhosis came back at least 2 stages. So that means that you're able to make somebody with that ugly liver I showed you a picture of actually lose cirrhosis over time.
他说大概有72% 那个病人就是得到肝硬化之后，因为药的关系而得到康复。
Our last virus that we'll go through in this aspect, and we're even ringing at me to make sure that I finish on time here, hepatitis C. So this is what Hep C looks like on the same electron microscope in this aspect. And this is a picture of what they think it looks like if you could actually see it a little bit better. So it also looks like one of those mines again, and trust me, it's a very bad disease too. Again, in the United States, you see for once now, we do have it. So we're in there from that aspect. About 5 million people have it. Notice much more in Africa. And again, even though you think Hep B when you think Asia, no, there's Hep C also in Asia.
现在不只是世界其他地方有这个病毒，连美国也有C型肝炎。
Percutaneous, needle stick, blood, needle. Take those 2 things. You get a blood transfusion or blood exposure, which you can get sexually, but much lower. In the United States, it dropped in 1982 from about 12,000 cases now to about 2,600 from this aspect, and a lot of underreporting. People really think it could be as much as 16,000 cases, but because of underreporting, a lot of the patients that are doing this at high-risk activity don't come into the doctor. they don't get seen. So we don't know exactly. Again, 3/4, very similar, John. Half end up in the hospital. Less die though, 0.4%. No vaccine for this one, unfortunately.
对新型病毒最主要就是说，他就说现在还没有vaccine 可以治疗这个病毒。
Again, just an idea of the cases being reported. It does look like it's going down, but it's not going away.
虽然说那个已经你可以看到就是你开始下降，可是它还是在的。
Biggest risk is in that 25 to 39, followed by the 40 plus, which is curious. Less so in the younger, so it's actually more of the adults that are at the risk in this aspect.
25岁到39岁的人是最有可能感染到新型病毒的。
And don't think, again, it does impact the Asian community. It's there, not as much as in the others, but it's there for that aspect.
虽然说新型病毒不是感染亚洲人不是特别多，可是它还是有的。
So again, the CDC likes to interview these people when they do get the report. 31% didn't know how they got it. 2/3 though mentioned drug exposure, so IV drugs is important. Sexual risk is there. Surgery comes up again here. Needle stick, household contacts, and job exposure is important to think about.
这也就是 CDC 的报告，就是说，大概有31% 的人不知道他们是怎么得到这个病毒的。大部分的人是因为那个发生性关系之后而被传染到。
Now, how many of the ladies here go to this place? You go, don't you? They do your nails, they do your feet, they scrape your feet with those razors that they scrape the foot, the callus, cleaning your foot. They dig at the nail, clean the cuticle. We can give you Hep C. Make sure the equipment is sterile. Pay a little more. It may look good, $9.99, but free Hep C. No free Hep C. Right.
他就是说很多人不知道，可是你要是去做指甲这些的，就是有很高的几率会传染到就是新型肝炎。
There are a lot of places actually you buy equipment, and so you have your own equipment, they store it, or they sterilize it and they open in front of you. I worry about when they go to a box, and they pull it out of the box, and then don't let them.
他说你要注意的就是你要是去那个做指甲的话，你要注意他们是把那些那个做指甲的东西都消过毒。
Men don't go here. Men go to spas. You ever get a gift certificate for a spa? So you're there, eyes are closed, they're massaging you, and all of a sudden somebody's playing with your fingers. And then you can feel them cleaning your cuticle. And you're not thinking. Women worry about fungus in the nails and those things. Men have no idea. Dr. Ho and I could be there and we would not know anything. We're just enjoying the moment of the spa. But we may come out. I see many men getting hepatitis from the spa. Make sure the spa also sterile needles.
他说就是虽然说男性不怎么去做指甲，可是如果你去 SPA 的话，也有可能被传染到。
Now, here's another example. You think you're safe. Okay, now we worry about the spa, we worry about the nail care. You go to a doctor's office, and they do finger sticking. Well, in Illinois, 21 people had a free finger stick screen, and 7 got hepatitis C from that. Because the person doing it wasn't well trained in how to do it right. California, podiatrist. You paid for that guy, right? Podiatrist, doctor, right? Doctor podiatrist. 115 people got exposed. 9 got Hep C, not cleaning right. This is a skilled facility. They shared the blood glucose monitor in Pennsylvania. This is that famous case in Nevada where the anesthesiology people were reusing the propofol syringes. So you go in for colonoscopy, and the anesthesiologist, to save a few bucks, uses the syringe a couple times. And 8 people got that. Here's a cardiology center. They were reusing the syringes, not good there. And then there's a hemodialysis center where, again, multiple issues happen. So be careful. Always look, is it clean? Is it sterile before it's put into use? Make sure that that's opened up if possible.
他说你要注意，就是你要是去医院啊，去那个医疗诊所啊，就是要注意他们的仪器都已经消过毒了。就是他说很多人就是在这些地方感染到急性肝炎。
When I was a medical student, the response rate was 6%. Now we're up to about 54 to 56% until about 2 years ago, when all of a sudden a new class of drugs came out. But before we get there, what did we learn? We learned that Hep C comes in different flavors. If you go to the ice cream store, you get chocolate or vanilla or strawberry. Well, if you go to the Hep C store, you get type 1 or 2 or 3. Type 2 or 3 with the old drugs could be cured 3/4 or more. But type 1, not as good. So we learned that type 1, not good. Type 2 and 3, better. Then we learned that if you were Caucasian or Asian, you did much better than if you were Hispanic or African American. We didn't know why. We thought maybe Latinos, African Americans are not so good on the medicines, you know, as far as taking. But they found out at Duke that it's actually this gene called the IL-28B gene. They tend to have more of the bad gene and less of the good gene. So they knew that was another problem. We then categorized people who were treated as either it did nothing, it did a little bit, that's called a prior relapse. Partial relapse, responder. And then there was the relapse where it worked, but then it came back. That was the relapse. So, came May, about 2 years ago, they came out with 2 wonderful new drugs which changed how we do hepatitis C treatment now. Oseltamivir is one that basically improved from 40% of response to 68, and here you can see even in African American patients it used to be very low, 23, now to 53. So there was almost a 20-30% improvement there with that treatment. And you can see here with relapsers and partials, it also improved it much better. So clearly it's helping the patients in this aspect. And CBIT was approved about a week after. It likewise also improved from 46 to 79, and again showed improvement in the Hispanics, African Americans, and even the cirrhotic patients. So much hope in this aspect with this new class. And this is again showing you people who previously relapsed. Remember, they were negative, but came up to get a very good cure rate. Partials, again, a little bit less than 60. And then people where nothing happened before. Now, 32% could respond. Much hope when there was no hope for these people. But, always, some people are still waiting. Some of you are probably still waiting for this aspect. What are they waiting for? The future. What's out there in the future? Well, I was told about pure electric cars. This close to buying a Volt, and then I find out it blows up if you get hit on the side. So, not buying a Volt. So, in many ways, we're waiting for this. This is interesting data that talks about hepatitis C and oral-only treatment. Remember I told you there was oral-only treatment for Hep B? It's now coming for Hep C. And for genotype 2 and 3, which is where it's very advanced, because again, remember 2 and 3 does better with everything. So they show here that with the old treatment you could get a 70-75% cure rate. But notice with these treatments, you could get close to 100% cure rate here coming with pills. This is maybe a year or 2 away. So the future, 1 exit or 2 away. Maybe this year, maybe 2013, no, 2014 probably, or 2015. But even for genotype 1, The hard-to-treat one. Also, look at this, 84% pills, 3 months, no shot, no ribavirin twice a day, no boceprevir or Zevig 3 times a day, no 1-year treatment, 3 months, pills. It's better than our Hep B drugs, potentially. Remember, Hep B only 9% circumstantial loss. That's with a long-term trial.
就是总结一下说，就是说现在在研发一个新的药，大概2-3年之内可能研发成功，这个对C 型肝炎是非常有效的，不像之前的药大概需要1年时间，这个只要3个月就可以很有效，大概有些病人有在100%的可能痊愈。
And in conclusion, I'll try to answer a few questions also. I know that the time is limited on that. I kind of knew it was going to take longer to be translated, but it wasn't so clear on how long it would take. But the vaccine has proven to be very effective for hepatitis A and B in this country. Providers, like the doctors that you have here working with you in the community, and also you yourselves as patients, can potentially educate people since you saw how well these vaccines work and realize that a few moments of your child crying isn't as bad as it seems compared to the disease. And again, I hopefully taught you to make sure that you got yourself screened and follow up with your doctor. Not knowing is not good. If you have a fire in your house, put it out. If you have a fire in your liver, watch it. See if you can put it out. You may not be able to put it out because it may not be a therapy for you. But if there is, you want to try and put it out. And then I wanted to thank, obviously, Dr. Ho, very much, Dr. Ho, thank you for the honor of being able to speak here. Sean, you did good. I tortured you a little bit, with some new slides, and you were saying, how's it going to be? I said, Sean, in medicine, you have to go with the flow. Go with the flow. I didn't know how it was going to be, but I said, I'm going with the flow. It'll happen. Now, one of the questions I've been told is a lot of people don't know about hepatitis tests. So let's talk a little bit, just for a moment here, about hepatitis tests. Hepatitis tests are the tests that you do in your blood. I can check anybody here right now to see